In the previous video, we learnt about learning in the metaverse. In this video, we will get to know about the impact of COVID-19 on medical technology. So, let's get started. The COVID-19 outbreak has spread throughout the world, leaving a trail of destruction and altering the way we work and live. The changes will have long-term consequences, and companies in various sectors, including medicine, will need to adopt new technologies and way of working as they adapt to these new realities. For example, Britain has already begun to rely on AI and new technologies to improve and healthcare sector and fight the virus more effectively. As a result of the shift to remote workforces and telemedicine, the technology focus is on security protocols for access to sensitive healthcare data and identity management practices, allowing the appropriate person access to the appropriate healthcare forms and providing relevant information on patient-centered care is more important. These technology requirements have not changed. They have only become more critical in order to ensure proper value-based medical care and improve healthcare delivery by providers. How can medical technology help during a pandemic? A medical technology and COVID-19 are related issue that will determine how the technology is used. The pandemic had an impact on medical technology industry, reinforcing the need for technology to assist us in monitoring social factors that impact patient health and understanding their impact on healthcare access and outcomes. This also highlighted the importance of incorporating social determinants of health into care planning. The virus spread almost instantly through densely populated cities, disproportionately affecting vulnerable populations, according to data. Integrating social determinants of health data into care models can help to close these gaps and provide better medical care to those in need. One of the beneficial methods is remote patient monitoring, which is continuous health control at home. This method allows patients' health to be examined outside of medical facilities, which is most convenient and safest option. Patients are frequently at risk of severe corona consequences because their immune systems, which have been weakened by other disease, survive the worst of the new virus. This is especially true for people who have cardiovascular problems, diabetes, respiratory illnesses, hypertension, cancer, bowel inflammation, disease. They require ongoing health monitoring, but face-to-face medical appointments are not safe for them. Remote monitoring shortens the treatment method by allowing relevant data sharing and meetings to take place without leaving the house, reducing the risk of contact with potentially infected people. Nonetheless, modern health monitoring technologies play a critical role in facilitating early problem responses and detection. This is significant because telemedicine platform receives and processes data from monitoring devices, applications, and systems. Furthermore, Comarch Diagnostic Point is available in both mobile and stationary configurations, as well as software and devices that enable quick and simple measurements of basic health parameters. The system determines whether the result is correct automatically and allow data to be sent to the remote medical care center for further analysis and recommendation for the users. The impact of digital technologies on the world of COVID-19. According to the UN website, the Department of Economic and Social Affairs issue a report noting that government developed services and apps to help fight COVID-19 to boost services such as delivering food and other essential items to those in need. This is accomplished by optimizing the supply chain via digital government services. Due to an increase in applications for unemployment and other social benefits, some member states saw an increase in online services such as digital ID and digital signature. According to the report, some countries discovered that digital applications can help test and trace people who have contacted an infected person while balancing privacy concerns and health imperatives. According to the policy brief, government frequently lack the financial and human resource capabilities to efficiently develop digital tools that can assist people during a crisis. Partnerships should be formed with social entrepreneurs, private technology companies, or other international and national organizations to use technology to meet people's need and mitigate the impact of the crisis on their lives. During COVID-19, digital therapeutics. Digital therapeutics are well established tools that deliver medical interventions through software and have been gaining traction for years, with products that treat a variety of conditions such as mental health issues, diabetes, and cancer. The dangerous growth of the digital health field during the pandemic is assisting these companies in making space for their products. However, the young sector is still confronted with the regulatory and payer side challenges, which may slow its widespread adoption. Using AI to accelerate vaccine deployment. In addition, Lydia Fonseca, Executive Vice President and Chief Digital and Technology Officer at Pfizer, emphasized the importance of the company's use of HPC and AI in developing groundbreaking vaccine and therapeutics for COVID-19. Across the entire value chain, Pfizer is using AI and digital data, Fonseca said, making our work faster and easier and enhancing every aspect of our business. We are driving this end-to-end innovation with three strategic goals in mind. First, to improve patients' health outcomes. Second, to get medicine to patients more quickly. And third, to fuel tomorrow's breakthrough therapies. Artificial intelligence based models have transformed drug discovery over the last decade. Summary of this article. The virus is convincing societies and government to turn to digital technologies to respond to the crisis, and it is increasingly requiring government to adopt an open government approach and use digital communication media channels to provide reliable information at both the global and national levels. COVID-19 advancements. Questions. Which country has already begun to rely on AI and new technologies to improve the healthcare sector and fight the virus more effectively? Which method is used as a continuous health control at home? Which department issued a report noting that governments developed services and apps to help fight COVID-19 to boost services such as delivering food and other essential items to those in need? What should be formed with social entrepreneurs, private technology companies, or other international and national organizations to use technology to meet people's need and mitigate the impact of the crisis on their lives? Which company is using AI and digital data? I will wait for your answers in the comment box. Thank you so much for watching and supporting my efforts. Good luck.